medical method used to provide nutrition to individuals who can't eat by mouth. It involves placing a flexible tube directly into the stomach or small intestine. This ensures that patients receive essential nutrients, hydration, and medications. It's often used for those with swallowing difficulties, certain medical conditions, or recovery from surgery. The process can sound daunting, but it's a lifeline for many, allowing them to maintain their strength and health. Plus, it can be tailored to meet specific dietary needs, making it a vital tool in modern medicine.
Welcome back to Sunrise. If you're just joining us, thank you very much for coming along, for choosing Sunrise to get you going on this Thursday morning. Well, have you ever heard of the term tube feeding? It is a method used to deliver medicines, liquids, and even liquid foods directly into the stomach or small intestine through a small tube. And this is used for patients who are unable to utilize oral intake methods and is typically determined by a swallow study test. It might sound a bit technical or even some discomfort, but don't worry. Very renowned pediatric surgeon here in Kingston, Jamaica, Dr. Carolyn Jackson is here to break it all down for us. Dr. Jackson, welcome.
Good morning.
Good morning.
Doc, how are you?
Thanks for having me.
She did some very good work on my son.
Lovely, lovely, lovely.
I won't say where.
Yeah.
It's
in
morning
business. Yes.
No.
The hippo rule. Hello. Hello. Privacy. Yes, Jackson has his lawyer. Please protect it. Right? But Doc, can we just make the distinction between a pediatrician and a pediatric surgeon?
Yes, so that is, a lot of times people think that I am a pediatrician. A pediatric surgeon trains in surgery. Oh. So the first 2 years of my training were general surgery. I tell people I was at KPH amidst the gunshots and the motor vehicle accidents, and then thereafter the next 4 years are, well, 3 to 4 years, depending on what you do, are focused on pediatric surgery. Okay. So we are surgeons who specialize in operating on children. And then within the pediatric surgery realm, you have pediatric cardiothoracic surgeons, you'll have pediatric ENT surgeons, because children have a lot of issues that are wide beyond. Sometimes it is, the training is more suited to focus on children and their different problems than the actual technical specialties. So,
and it's fascinating because children, because their body parts are so much smaller.
Yes.
There are different stages of development, and so in operating on them, you just have so much care that you have to apply. So thank you very much for what you do.
And I like that, Doc, because a lot of times, you know, as parents, your child is going through something, but you don't know that these things and these people are here in Jamaica, Dennis. Yes. If you're not in a certain circles, it's almost as if, oh, pediatric surgeon there? Oh, I never know, but think of foreign. But we have qualified persons here who can do the job and do it well.
We have a remarkable amount of persons who are specialized, I mean, education, in psychology, in surgery, in medicine, who specialize in pediatrics. And, you know, one of the things we probably need to look at is how do we, as professionals, make ourselves available or help the public to know.
Well, this is one of the ways.
Definitely.
Definitely. I'll take it to the Pediatric Association.
Yes, yes, lovely.
Tell us what might be some of the telltale signs that your child has a problem where swallowing is concerned, and then you might need to do a swallow study.
Okay, so usually swallowing issues are related to global neuromuscular issues or global issues with movement. So you'll find that children who, for example, have cerebral palsy, children who have other issues going on with them, the feeding issue is just a part of a more widespread thing. Now, in recent times, when we've been acknowledging and accepting, there are a lot of children who have sensitivity issues, and so there are certain foods that the texture will throw them off, the color will throw them off. That is a different issue. So sensitivities, oral sensitivities is a different issue from actual swallowing issues, which is the mechanics of swallowing doesn't work. Swallowing is actually pretty fascinating, and that's the realm of ENT surgeons. Yes. That's not me, but you have to shut off your airway and get that food down, because if it gets gets into the airway, it's going to be a problem. It's hard to get it back out.
We don't want to choke, so I want to take time and digest all that you're saying. So we're going to take a break. We're going to go to the news, and then we're going to come back and continue to digest all that you've just said and what you have to say. It's fascinating, to say the least. You're watching CVM Sunrise. We're going to break for the news.
Welcome back to Sunrise. Good morning to Gariana Messam of Fletcher's Land fame, a student of Myrtle Grove High School.
Lovely.
Sixth former. She knocked her CAPE subjects out of the park.
Oh, wow.
Good morning to you, Gariana.
Oh, so CAPE results came out too?
Yes.
Oh, nice.
Yes, indeed.
All right.
Well, the process of tube feeding, we're talking about that. Very important issue with Paediatric Surgeon, Dr. Carolyn Jackson. Before the news, we were left off explaining the difference between oral sensitivity issues and swallowing issues. Let's get back on that.
Yes, Doc.
Yes. So children who are unable to swallow are the ones who are going to benefit from bypassing the oral mechanism to be fed. And one of the things that parents tend to be anxious about is, if I don't feed my child orally, is it that they will never be able to feed orally? So if we get a tube, is it a life sentence? But the truth of the matter is, depending on why it is the child is unable to swallow, sometimes when we can improve the nutrition through the tube, they become stronger, they're able to do their therapy, their speech therapy and so on, and they will learn to swallow and become less and less dependent on the tube. So depending on what is going on, sometimes the tube will be a permanent feature, or it will be a temporary feature to allow the child to grow and develop the muscle strength that they need to do the things that we want them to do.
What is the prevalence of this kind of a challenge, would you say?
Having worked in both the government sector and in the private sector, I'm going to say what I have observed, and this is anecdotal, is most children who have this type of neuromuscular problem end up in children's homes. So parents are very overwhelmed by their inability to cope, and so most of the children that I have worked with have actually been from children's homes.
Wow.
And it is only recently that I have met more parents who have made a decision to continue the care of the child in the family home, and so they are reaching out for help.
Doc, why they can't swallow? Somebody said, "What, Doc, we're born, we have throat, and you just go so, and you swallow." I mean, it looks so easy, but what are some of the reasons
that they would not be able to swallow? You can actually be born with that reflex. That mechanism is abnormal.
Wow.
So the nerves to the larynx, the nerves to the pharynx, the nerves, a lot of up and down takes place in the throat, and if that's not well coordinated, you can actually be born where the nerves are not working properly, or where the muscles are just too weak to do the job.
You know, I've said I have a picky eater on my hands, and I've always had the challenge that, and I've said, when we look at the things that he eats, they're all the same texture. Crispy, crunchy things. He does not like soft things. And I've always said that I've told you before, he's a professional vomiter. Like, you force him to eat it, he's just going to vomit it. And I'm now thinking that maybe well, I've always felt it's an issue with textures that he does not respond well to.
So therapy can help that,
It could be that, to answer your question, is it that there are just textures that don't, because of the where their body is at a particular time, can they get over that resistance to a particular texture?
So that type of texture resistance is definitely something that a occupational therapist or a feeding therapist can help with. A lot of children, it's important for us to acknowledge that children, just like adults, there's some things they just don't like.
Yes.
You know, you cannot force me to eat certain things. And children are the same way.
Yes.
But we do want to maintain a certain range so that they are familiar. And one of the big challenges is when a child is weaning, so between like 9 and 18 months is the best time to expose them to all the different textures and so on. And so sometimes, I mean, we go to old time Jamaica where you boil and mash and there are little lumps in it and the child has to eat the lumps and the squash shape part. That helps that child to adapt to different textures. When you have the more commercial smooth blend. They don't necessarily get to deal with that as much. It's the same thing with porridge, the lumpy porridge. You need to learn to manipulate those lumps. So it's that period between 9 and 18 months, it's a very sensitive time to allow children to really explore and get into it. And then another thing is we sometimes we're a little more afraid of the mess than before, so to allow the child to touch it, to squish it, to rub it in the hair, so it spreads on the table, and to literally to play with the food, to be comfortable with all the different textures even before it reaches to their mouth. And nowadays, in these times, sometimes it's more difficult for us to have the time for the kid to be able to do that. You're eating on the run, you're eating in the car, you're eating, so there's a lot around feeding and making food a social event for a child that is changing for us, but food is really a social event. Children feed best when they're sitting with adults who are eating what they are eating.
So, Doc, talk to me, please, about the tube that's available, right? How do we know which one? And a surgery like that, how rigorous is it? Okay,
so the surgical procedure itself is a fairly straightforward procedure. It is a combined endoscopy where you look through the mouth into the stomach, and then you know for sure where you are, and you can put the tube directly into the stomach. So there's no additional cut, just where the tube goes in. And the scope helps us to know that we're in the correct spot.
Yes.
The surgery is done, the surgery itself is less than an hour, and the child is able to go home right after. But when I say right after, the same day. But they will be asleep for the procedure. I
was about to ask.
Yes. Well, I'm going to tell you, if I could cut children's fingernails asleep, I would do it. I'm a big fan of appropriate anesthesia. But it's important to know that tubes are also used in older persons, so adults who have had accidents and they've had injuries to their nervous system, people who have had strokes who aren't able to swallow, they too may benefit from a tube. But with kids, we find usually it's children who are born with abnormalities that don't allow them to swallow well. And the tube just allows us to give them the food. And one of the most amazing things I have seen with the kids who I have put tubes in, when the parents come back a month later or for their 2-month visit, and they said, the child is just so happy. We didn't know that they were so unhappy before, because they're, even for a child who may be nonverbal, you can see the smiles, you see the joy, you see them interacting more. You know, we want food.
Want food. Want food, mommy, want food. Well, Doc, I'm happy to know that people like you are in Jamaica, and procedures like these are performed in Jamaica. So for those parents who may be wondering what is wrong, and oh my God, I wish Mom could do, it happens right here in Jamaica. So Doctor, you and your team, thanks for all that you do, and you're always welcomed here on Sunrise for us to disseminate this information to the mommies and daddies who need your kind of help and service. So thank you so much.
Thank you for having me.
Our guest has been Dr. Carolyn Jackson, a pediatric surgeon. Let's check on the birthday boy. Let's check on the birthday boy.
We're not paying him for today. We're docking today from his pay.
He drop asleep. Good, you know.
Yep. I want to thank, you know, Jeline, is it?
Jeline,
yes. Hi, Jeline, from Waxaderma Spa and Body Contouring for treating DeAndrew this morning to a well-deserved massage. And I got to tell you, Jeline has done a fantastic job. It looked like, I wonder if we can go pinch him in them ears. Somebody, oh, he's actually awake. Oh my goodness, I thought he was sleeping right there. Thank you, Jeline, Waxaderma Spa and Body Contouring. Thank you guys so very much. DeAndrew's going to continue luxuriating in his birthday gift. We're going to take a break and we'll be right back because we're working.
We are working.
I'll eat Doc today from DeAndrew's pay. Yeah. What a way Michaela get a pancake cake.